Hi, I'm Dr. Ben Noble. I'm a GP and I work with the East Midlands Cancer Alliance. Thanks for joining me again. This is the third and final video in our series all about prostate cancer and the PSA test. In this video, we're going to talk about benefits and potential harms of the PSA test, PSA testing in men without symptoms, and practical points to think about before having a PSA test. I'll also give you advice on where to go for more NHS-approved information. When thinking about a PSA test, it can help to look at both the benefits and the downsides. On the plus side, a PSA test can sometimes find a serious prostate cancer early, before it spreads. This can make treatment more effective. For men at higher risk, for example, if prostate cancer runs in the family or you have certain genes, an early PSA test can help doctors decide how closely to monitor you in the future. But there are also possible downsides to think about. PSA tests can give false alarms, meaning the result may be raised even when there is no cancer. This can lead to extra tests and worry. The test can also find very slow-growing cancers that may never have caused any problems. Once found, these cancers are often treated anyway, and treatment can cause side effects such as problems with bladder control or erection. For men who are unlikely to live more than 10 years, the harms of testing and treatment usually outweigh the benefits. In these situations, a PSA test is not usually recommended. That's why deciding whether to have a PSA test is a personal choice and one that's best made with your doctor. If you don't have any symptoms, PSA testing isn't routinely offered to all men in the UK. That's because the test has both positives and downsides. If you are over the age of 50, you can choose to have a PSA test if you feel it is right for you, even if you have no symptoms. Your doctor may want to discuss your history and examine you before requesting a PSA test. If you decide to have a PSA test, there are a few easy things you can do to help make the result more accurate. Avoid sex and intense exercise like cycling for 2 days before the test. And if you've had a urine infection, make sure it's fully treated and wait about 6 to 8 weeks before having the test. If you would like to have a PSA test, please speak to your GP practice to find out more. You can also find further information on trusted websites such as NHS UK and major cancer charities. Whatever you choose, what matters most is that it feels right for you and your own health. Remember that prostate cancer is not one disease, but a range from harmless to aggressive. The challenge is not to find prostate cancer, but to find the right prostate cancer. Thank you for watching, and please share this video with your family and friends.